Mike McCool here. I'm in the Royal Examiner studio, and today with me is Rick Farrall. Rick is the Deputy Emergency Coordinator for Warren County. Did I get all that title right?
That was great, Mike.
That's good. That's what
Yes,
I
sir.
want. I know, because everybody's got these big, long titles, and I ask, what else do you do, Rick, there? And you got 3 or 4 more titles as well, don't you?
I do, yes. A little bit of this and a little bit of that.
Today, we're going to talk about the emergency response coordination that you do, things with the COVID-19, things that we can do, to make us safer, and what the county is doing, what the state's doing, just kind of bring us up to date. How many cases do we have? That's the magic thing everybody wants to know. Well, how many do we have? How many do we have?
Right.
I think I told you earlier, I said, I'd like to know how many we don't have, So
Yes.
that's as important as well. So why don't you go ahead and start us off and bring us up to date on what's going on in the COVID-19 world.
Well, so you brought up numbers. Right now, officially, with the Virginia Department of Health, we have 19 cases attributed to Warren County. I want to highlight the word attributed to Warren County because
Right.
it's whatever's on your license, whatever your home of record is, that's the locality that gets credit.
They get credit for that.
That's right. So we already know early on we've had some cases where folks were from another locality to the east, and we weren't sure who was going to get, quote, credit for it, but we did not. Even though they had a vacation home out here or something,
Right.
It's wherever your primary residence is. And likewise, just because somebody is diagnosed with COVID-19, it doesn't mean they're in the hospital. It doesn't mean you don't know if they're at home. You don't know if they've left the area.
Right.
Right.
And we don't know how serious their symptoms are. Like you said, a lot of times initially they just go home and self-quarantine. Is that correct?
That is correct. And sometimes, depending on how you talk to your doctor may even tell you, don't even bother coming in. It's not that serious. You're not going to feel well for a few days. Get some Motrin, some
Right.
cough syrup, stay home.
If it gets worse,
And-
call me.
That's right.
Kind of what they do about everything else that's wrong with you.
That's right. So you may not, so data-wise, you're not going to see a change in the numbers in that case.
Right.
Or likewise, your doctor could say, you know what, it doesn't sound that bad, but I think you might have it. They'll send you to the drive-by tent on Commerce Avenue.
Right. That's that yellow tent.
That's the yellow tent. That's
in
right.
the parking lot there. Yes.
We probably see about a dozen or so folks there a day.
Can they test?
They're going to swab you right there. You don't even get out of the car, and off you go.
How
And
long
then,
does this test take to get a result?
It takes about a week or so
Okay.
to get those results back.
So meanwhile, if you have it, they tell you to go home and self-quarantine. Is that the protocol?
Yes. And I would humbly ask everyone that if you are self-quarantined, please respect the quarantine.
Right.
If after 8 days or so you get a phone call that says you're good, then you're good. If you get a phone call and says you have it and there's no other serious things going on, then
Stay in the quarantine.
Stay in the quarantine till day 14 or so. And at the end, you can call your doc back and check in with them and go from there.
Yeah. Everybody, it's different with everybody, isn't it? I mean, it's kind of like I won't say it's kind of like the flu, but I mean, it's the same symptoms. Some people get it real bad. Some people don't even know they have it.
Right. I've talked to some people who had it or had something like it
And there you go.
for maybe 3 or 4 days. They didn't feel well and they were fine. Other people, it could be a couple of weeks and then they're fine. And then some people, if you have an underlying condition, you may require hospitalization.
Right.
But
right.
that's the few and far between folks.
Yeah.
I mean, we were talking earlier. I think it's like under 3% of the folks that are actually hospitalized that are tested and diagnosed.
Right. Well, it's like, you watch these drug commercials on television and they're going to treat whatever the problem is. And then the side effects, my gosh, I can remember, bro, I'm not taking that drug.
Right.
The side effects are worse than the disease I have.
Yeah.
So it's kind of like the same thing. So let's talk about the key messages we can get out to the public. Well, we've heard these things many times, but
yes.
you kind of summarize them and put us in a good place.
I don't want to beat a dead horse, but washing your hands.
First thing he asked me when he walked in the building, you have any hand sanitizer in here? I said, yes, right here.
That is the best thing. And soap and water. Everybody wants to buy Purell and all these other products, but good old
Can't beat
fashioned
old soap and water.
Soap and water is the best. I watched this video with this doctor from New York, and early on, before the governor started advocating the cloth face masks,
Right.
We're now advocating the cloth face mask so that if you cough, it's not overtly going out.
Right.
Well, this doctor in New York several weeks ago was advocating everybody wearing a cloth face mask to train yourself not to touch your face.
Exactly.
So it wasn't that you were trying to protect you from somebody else. It was to protect you from yourself.
And make you aware.
That's right. So I think once folks can, we all, hundreds of times a day, you unconsciously touch your face.
Constantly.
So if you can stop doing that,
ear,
that in and of itself, I think, will go a long, long way.
Right.
And of course, now the president and the governor, they're advocating that you wear a cloth face mask where you can't be, properly social distance
Right.
at the doctor's office or the grocery store, et cetera.
Yeah, when I went to the doctor's office the other day, they had a paper towel with a rubber band hooked on it, and everyone had to keep it in the office. Every little bit helps. It does. And they were letting one person at a time into the office. You stay in your car, then they'll call you up and come on in. They were trying to keep, keeping it limited to what it is.
I think the other thing is, without getting into brand specific or name specific things, would be please support local businesses. Because when this thing is over with, we don't want all our small local businesses here, the doors are still shut because they can't afford to open back up again.
Right.
So support local business when you can. And finally, I think, everybody just needs to be in the mindset that we could be in this for a few months. Everything I'm seeing modeling wise, I would be happy if we were starting to go back to normal before the end of summer, Labor Day. So it could be that long.
Well, it's a definition of what's normal. I think in our particular area, it's not we don't seem as restrictive, let's say, as New York City. But there's a lot of restrictions on a certain part of our county, a certain type of businesses that we're used to. We're used to going to LDs and hometown and family diner for breakfast every morning. That's more of a social thing. And it's not like we missed a meal or anything, but it's those are the kind of things that people are missing out of their routine, I think. And some of those things will come back sooner than others. Again, the restaurants might be open, but it might be limited to 10 or 20 or 30 people, whatever it is, or so much per square foot, And I think we'll see some variations. And it may never be like it was. So I think we just need to be prepared to adapt to the changing culture. Because if we do this long enough, our culture will change. Yes. Our attitude, our habits will change.
Yes, well, I think they're already changing.
Yes.
And you brought up the word adapt. So I think what I'm most pleased with, at least at the local level, both with the county and the town, I think we've adapted very well to some non-traditional things we haven't done in the past, like our social services partnering with CCAP to get out food, social services partnering with a thermal shelter to house our homeless population. The town has created a help number, which is fabulous, and it has several choices where if you are interested in this or that, you can push number 1 through 6, and somebody will actually get back to you. So those are all, I think, good outcomes of our adaptability here.
We're pushing the information out there, and if people have a need, there's really no excuse nowadays not to find out something. We'll put all these numbers in the story on the Royal Examiner, the website. Every day, we have the governor's. Every other day, we're having the governor's briefing on our website. All the phone numbers, all the things that the county is and the town has put out there. So, we're trying to get the message out, and most of it is common sense. But there's a few things that we need to. It's like kind of wearing your seatbelt. There's a lot of people still don't do it, but in the long run, it's good for you.
But that took a long time ago, I think, for people to actually, because I remember as a kid growing up, we never wore seatbelts.
No.
And the first couple of years we did that. It was you felt.
My 90-year-old mother, every time she gets in the car, I got to tell her, put her seatbelt on. And, she's just, I forgot. How can you forget? You've been doing it for 50.
Grew up. Yeah.
And those things go back. I can remember riding onto what do you call that little thing on the back of the car? Used to have that the deck, and we'd lay up there and drive down the road and stand up in the front seat. But we ate a lot of dirt. That's how we survived. We're strong.
Yes.
And I think that's kind of what Americans do. We face things head on. We're not. We're not afraid of anything.
Right.
But we just got to use common sense and pay attention to things. Most of these things are not trying to take any rights away from people, or we're trying to protect the public, and the public's pretty large.
And I think in protecting, I think there is some confusion out there. Nationally we put out guidance, and then you have national level organizations, and then you have the state, and then you have local. Locally, we're trying to still keep things open,
right?
Yet comply with the governor and national guidance. And so we're not trying to be so restrictive. And even something as simple as the closure of Shenandoah National Park, we didn't have anything to do with that locally. That's a federal government call. But we did close our parks, but we did keep certain aspects of them open, like the trails and the open spaces and even the golf club. And we've gotten a lot of comments on the golf club. Is it essential? Is it not? But it meets the guidance with social distancing.
As long as people follow the rules.
That's right.
It's kind of like the parks. People didn't follow the rules, so they didn't have much choice but you didn't follow the rules.
That's right.
So that 2% that didn't follow the rules, the other 98% of us, which suffer for it.
That's right.
Well, maybe suffer is not the right word, but I'm not going to go hiking up.
Pay the price.
That's right.
But I think we are trying locally to do our best not to just be so draconian and close everything,
right.
But keep open what we can keep open.
Mr. Mabe has done a good job of kind of riding the herd on things. He's very open, and he's trying to get the message out there. Thursday, I guess we'll have another briefing by the board, and I'm sure you'll be there as well again.
I will, yes.
And I think people just want information. What's going on? It's good to say, we have 19 cases. That's really low. I mean, compared to other localities, just 50 miles from here, they got 200 cases.
Right.
And so we're doing something right, and people are following the rules. And I say this too shall pass, but we want it to pass quickly and safely, and pass through,
right,
and not linger here too long.
Well, that is a balance, I think, between health and the economy. And I know there are some folks that are ready to get the economy going again, but there could be a cost on the health side. So there is that balance
right,
that our medical professionals and our economists need to work out on the way forward here.
So I said we just posted a story from the governor today that they have a little presentation on there. If you're interested in how models work, how they come up with all these numbers, and it's interesting. And they foresee now that Virginia's in pretty good shape as far as handling, hospitals and the amount of beds and things like that. So they predict that they've been doing a good job in keeping the numbers down. So as a whole, I think we're going to ride through it okay. That's the latest model.
Yes.
Subject to change.
Yes.
But
I guess all of these models talk about it's with the social distancing.
Yes.
And so the more disciplined the citizens are with social distancing, that the flatter the curve is. But the flatter the curve is, the longer this will go on. But you'll have better health effects in the end. And I did want to bring up, we had talked about earlier, here locally, if you were to get diagnosed and you did require hospitalization, folks could expect that if you're seen at Warren Memorial, as long as there's space available up at Winchester Medical Center, Warren Memorial, Shenandoah, all the outlying hospitals at Valley Health, will take those patients and will transfer them to Winchester until Winchester gets full. And if Winchester fills up with COVID patients, then we'll start to keep the folks at the local hospitals.
Right. So people are still projecting healthcare things to start changing in April, May. The date flexes a little bit. I think it's good. You kind of give people hope, that things will be over sooner than later. And not to stretch it out too long, but I think people can. It's like eating an elephant, one small bites at a time. So maybe we kind of do this, we kind of like just take small chunks of it and not really worry a year from now. Let's worry about next week. You take it. Let's look from here to next week how we can get by, and then the same way, we don't need to hoard toilet paper.
That's right.
And I mean, the supply chain is working. Buy what you need when you need it. You should have some, if things turn down, but we don't need a year's supply of stuff in our house.
No, but I would say that slowly building up to 1 to 2 weeks worth of supplies.
Exactly.
Over-the-counter meds, toilet paper, basic foods, so that if you do get sick, you can take care of yourself and whoever's in your household.
Without having to rely on people bringing
That's
stuff
right.
in and out of your house.
Right. And then you're putting them at risk. And then you can be self-sufficient and we'll get through this.
We're going to have a glut of stuff here in a couple months, aren't we?
Yes. Yeah, we are. We're probably going to have a lot of masks left over.
We have a lot of masks and ventilators, our food in the house. All of a sudden, the grocery store, so everybody can come now, and then no one shows up. Well, I got a month's supply of food. I don't need to buy anything.
Yeah, but I want to go back to this modeling real quick.
Sure.
So we talk about this peak in Virginia being towards the end of April, right? But that's in the state. Out here in Warren County, out in the Shenandoah Valley, we're going to be several weeks behind that. And just because we've peaked in the state at the end of April, maybe we don't peak here in the valley until mid-May, but that's at the height.
Right.
We still got we got a long way to go still on that downward curve that's going to take us into the middle to the end of summer. So I think everybody just needs to be prepared for that. And it's not just because we peak, it's not peak and done.
Right. Well, I think we're going to see, we already have a change in how we do things. Our culture, so to speak, our social culture will probably change. Like you said, some businesses are going to have a hard time coming back. Of course, our main business in Rely is in the entertainment industry, and that has just taken a beating. It's just like completely chopped the legs off from underneath of it. So that's going to be a hard one to come back from. So,
yeah, but I would say for all of our small businesses out there, if they haven't contacted the Chamber of Commerce, please do so.
Right. Because
there are a lot of programs out there that could help them, and small business loans and things to help them get by. They just need to ask.
Right. Well, we appreciate you coming in today, Rick. You have anything else you want to talk about? I think we've covered
this was great.
It's good. You're welcome to come back anytime as we get some new information that needs to get out. This is a great avenue for it. We're here to help any way we can at the Royal Examiner. So, and we do appreciate everything you do and your staff and all our EMTs and our firefighters and our sheriff. It's still, all that work still has to go on. And it does go on. You know, we don't see it every day. But there's a lot of our first responders that are out there ready to go when called. So it's a lot of we appreciate it.
Well, thank you very much.
Thank you very much. Thank you for your service.
Well,
that's the current the phrase, I guess. I get a lot for my military service, but just not forget our first responders. They're in the forefront of what's happening today. So again, thank you for all you do, and we do know a lot of stuff's going on that we may not be aware of. But we'll depend on you to come back and tell us.
All right. Well, thanks, Mike.
Thanks again, Rick.
Have a good day.